name's Tim Roark. Today I'm going to show you how to put a neonatal vent circuit on a Puritan Bennett 980. So first you will need the EvaQuad 2 vent circuit with a reference number RT265. And in that vent circuit kit you will have a heater concha that for the water for the heater, for the stir water to drain into for the heater. We'll go ahead and place this on the heater as such. I'll get my heater temp probes off of there. Just push this lever down. This slides in as such. There we go. Then this top blue piece, pull it out, discard it. Your water line, pull it off, and you can unravel it. And this, once you're ready to use it, then you pull this out. This is what will puncture your water bag. Then the water bag will feed stir water into your concha. But until we need to use that, I'm gonna get it over here out of the way and hang it on the side. Out of the way. So then the next thing, you'll have your inspiratory filter, which is just a white inspiratory filter. It goes on your inspiratory side of your vent, right here. And then you have your exhalation filter. And this is the type of exhalation filter you use when the ventilator is going to be in a neo mode. It's used for neonates. And it slides right in here. This part slides right up to the top. And you want to angle it so that this spout is coming out to the side. So slide it up here like this. Push it up into the top. Shut the door and then lock it in place. Okay, so now we have our inspiratory filter on and our expiratory filter on. Now I'm going to place the circuit on the ventilator. The first thing I want to do is I'm going to use the limb that goes from the inspiratory side to the concha. Okay, so it attaches as such, and then this limb attaches to that side of the concha. Okay. Now our other blue limb, which represents the inspiratory side, will attach to the other side of the concha. Press it down. Now our expiratory limb needs to attach to our expiratory filter, but to do that we have to have an adapter, and the adapter comes in the little bag of adapters that comes in the circuit kit, and it looks as such. This is what it is. Okay, so your circuit will attach there, and then this allows it to go into the expiratory filter as such. Okay, so now we've got our circuit on, our vent is dressed. Now I'm going to put my temp probes in line so that when it's testing for a leak, it can make sure that my temp probes are in good. So the temp probe nearest to the heater and that has the shortest line attaches right here to the circuit right above the heater. It's got a little V spot there, and I don't know if you can see this temp probe has a little V spot there, so it slides in just like this. Okay, and then the more distal, the longer end, the distal end goes proximal to the patient. So then it will attach right here. So I'll pop that out. The other temp probe goes right there. All right. Now my cables that I will use to activate the heater wire in the circuit, I'll attach those last. That way, when I'm having to do some stuff here, they won't get in the way, but I'll attach those last. So now I'm going to turn my vent circuit on. But before I do that, I'm going to take this cap off the end of it. Turn my vent on. The power outlet for the ventilator should be plugged into a red outlet. The power cord from the heater should also be plugged into a red outlet. And then you'll use your air and oxygen hoses in the back, should be plugged into the walls your air and oxygen outlets in the room. Today, for this demonstration, I'm using the tank on the back and the internal compressor. This takes a few minutes for it to come on. Then once it comes on, we will do a short self-test. And it's a little bit different than doing a short self-test with the HME because we're using the humidifier. So there's just a couple of different steps that we would do. So now it's asking me, it says new patient, same patient, SST. So we're going to select SST for short self-test. I'm going to hit run all SST. Accept that, because it says please accept to confirm beginning SST. Accept. Now I have to choose the circuit type, which is the neonate size. Humidification type, you've got non-heated expiratory tube, heated expiratory tube, or HME. So because we have the heater here, it's the middle one, heated expiratory tube. Okay. And the humidification volume 550, that is per the operator's manual when using a neonatal circuit on this vent. So we've got that set at 550. So I'm going to accept. Then I'm going to follow the instructions. It says connect circuit with inspiratory filter and without humidifier. Okay? So I'm going to disconnect here. I'm going to leave my filter on. Then I'm going to take my circuit off the top of this, connect it right there as such. So we've bypassed this heater. Okay, we bypassed this humidifier. So now I've done that, I hit accept. It tells me to block the Y. And with the neonatal circuit, it's always best to use the cap that comes with it. I've tried times before to use my hand and it just doesn't ever do as good. So I use the cap, hit accept. Now it says testing oxygen, please wait. And the whole short self-test itself should last just a little bit under 6 minutes. Now it's testing the air. And again, when you're testing this up in the room that we test them in, you won't be using the internal compressor. So that's what you're hearing now. That's just a backup when the air is not hooked up. Now it's doing lift off. Got about 30 seconds left of it. And when it needs us to do something, it will prompt us to do something up here at the top, and it will be in yellow. And it will tell us what we need to do. Until then, it's doing a lot of its internal self-testing stuff. So now it says, connect the prox sensor at the Y, or cancel disables the prox sensor. We're not using the proximal sensors, so in this part of it, we hit cancel. It's testing for leaks. Okay, now it tells us disconnect circuit at expiratory filter. Here's the expiratory filter, so we'll disconnect there. Hit accept. Now it says reconnect circuit at expiratory filter. So I'm going to connect it back. Hit accept. Now it says unblock the Y. So I'm going to take my cap off of the Y. Hit accept. It says block Y. So I'm going to put my cap back on my Y. Accept. Now it says connect the humidifier. So now, earlier we bypassed the humidifier, now we're going to connect it. We pull this off. That goes back on top of the concha. Then this limb will hook back up here. So now we've got the humidifier connected again. I'm going to hit accept. It's doing another leak test. Now it says unblock Y, so I'm going to unblock the Y again by taking the cap off. Hit accept. And we've passed all of our SST. So now we're ready to put it on a patient. And that's all there is to putting the neonatal vent circuit on the Puritan Bennett 980 and putting it through its SST using the humidifier in the neonatal mode. Thank you.